My name is Abigail Myers, and I'll be presenting data from my master's project, which focuses on investigating gestational buprenorphine or morphine exposure on offspring outcomes using a translational rodent model. The number of pregnant women diagnosed with opioid use disorder has increased substantially from 1999 to 2014. It's important to note that opioid use during pregnancy is known to result in neonatal opioid withdrawal syndrome, or NOWS for short, and it's also known to impair offspring development. Buprenorphine treatment is often used as an opioid maintenance therapy to help mitigate withdrawal symptoms and some of these developmental deficits that we usually see. However, the underlying neurological mechanisms involved are poorly understood. It's also unknown whether discontinuation of opioids in late gestation, given enough time for clearance of the drug before birth, could rescue these effects. So we had two main objectives, and the first one was to evaluate the effects of gestational exposure to either buprenorphine, morphine, or saline on litter characteristics, early neonatal development, withdrawal symptoms, and neurological outcomes. Our second objective was to determine if discontinuation of buprenorphine or morphine treatment in late gestation could mitigate these observed deficits. And although discontinuation isn't directly clinically relevant, it will allow us to determine the acute effects of opioids in the system at the time of birth compared to chronic gestational exposure throughout pregnancy and into the postpartum period. So female rats were assigned to one of 5 groups: saline vehicle, buprenorphine continuous or discontinuous, or morphine continuous or discontinuous. Rats began opioid administration 7 days prior to mating to mimic opioid use in humans, and buprenorphine groups received 1 milligram per kilogram, and morphine groups received 3 to 6, and these morphine doses increased once a week due to increased tolerance over time. And then on GD19, or gestational day 19, our discontinued group stopped receiving drug, and our continuous groups received drug throughout pregnancy up until postnatal day 2. On PN0, or postnatal day 0, and each subsequent morning, we assessed mortality and we counted milk bands. And then on PN1, we took their individual weights, temperature, and body length. We called down to 4 males and 4 females per litter, and we observed them for NOWS symptoms. And then finally on PN2, we measured their weight, temperature, and body length again, with the addition of a surface writing task to measure muscular development. And then after that, litters were sacked and blood and brains were collected for subsequent analyses. So you can see on the graph on the left, buprenorphine, regardless of continuous or discontinuous exposure, resulted in higher postnatal pup mortality by PN2. And then on the right, you can see that opioids resulted in increased NOWS symptoms on PN1. So our buprenorphine continuous, discontinuous, and morphine continuous groups all exhibited significantly more withdrawal symptoms compared to our control. Opioids also resulted in lower pup body weight on PN2, as you can see on the left. So our buprenorphine continuous, discontinuous, and morphine continuous groups all weighed significantly less than our saline group. And these 3 groups also weighed significantly less than our morphine discontinued group. And then on the right, you can see that our buprenorphine discontinued group was significantly smaller on PN2 compared to our control group. So our results suggest that buprenorphine and morphine both negatively affect pup development. However, buprenorphine treatment resulted in higher rates of pup mortality, lower pup body weight, and increased NOWS symptoms as compared to morphine and control. Discontinuation of buprenorphine did not mitigate these observed deficits. However, discontinuation of morphine appeared to have a rescue effect. So these outcomes expand upon previous studies from our lab, and it really calls to attention the detrimental effects of buprenorphine during gestation and offspring development. And for information on maternal behavior data, you can see the IP104 presentation by Lauren Richardson. Again, I'm Abigail Myers. I'm a graduate student at Wayne State University. Our lab members and PIs are here on the right, and this project was funded by Rebuild Detroit. So thank you so much for listening to my presentation, and please feel free to reach out to me via email with any questions you may have.